Hi, class. It's Dr. Lindner. We are still on the blood vessels. We're now going to focus on the lower half, primarily of the arterial system. We've already covered a separate video for the head. We've covered a separate video of the arm. We did a separate video of the trunk. Now we're looking at this, which will cover the lower extremity. And again, like I said in my introductory video, you kind of want to draw these out in a linear fashion, but here is the full schematic, not of everything, but most of what we need to know. I'm going to focus on some of the primaries. There are so many blood vessels. Let's try and focus on what I feel is most important, and it'll give you a foundation to start with. So here is the common iliac. Remember this common iliac, everything that has the word common, we said is safe to assume that it will divide into an internal and an external something, and it did. We're just going to focus more on the external iliac because, as you can see here on the lower right, from the external iliac is where we're going to have the major arteries that I want you to become familiar with, okay? Because I don't need you to know all of these. So the ones that we're going to focus on from the external iliac, then the femoral, from the femoral to the popliteal, and from the popliteal, there's going to be an anterior tibial and a posterior tibial, and from that posterior tibial will be the fibular artery, and from the anterior tibial, we will look at the dorsal pedal artery. Okay, so what it looks like here, let's just see if we can follow them down. Here's the external iliac. If we follow it down and follow it down right here, there's your femoral. If we follow the femoral down, you can see that it looks like it's going posterior, and it is. So on this side, we're looking at an anterior view, and on this side, we're looking at the posterior view. So if you look at that posterior view, look at that femoral artery, and right there behind the knee, where the popliteal depression is, the popliteal fossa, is the popliteal artery. Okay, and this is the right popliteal artery. Then we look at that popliteal and we find our way down. The popliteal leads into the posterior tibial. We can see the posterior tibial also leads into the fibular arteries here. And we see there posterior tibial to the fibular artery. Okay. The anterior tibial, what's happening here is that that popliteal comes down and there's a branch, and that branch, one of those branches is going to go between the tibia and fibula and come anterior. It's going to go anterior, and that's going to give rise to the dorsal pedal and the dorsal arch that's going to feed into the toes. Okay, let's look a little further here. So we're going to look at the external iliac, follow it down into the femoral, popliteal, anterior tibial, and the posterior tibial. Posterior tibial will lead into the fibular artery. The one that I didn't mention is the deep femoral, or the descending genicular, or the lateral femoral and medial femoral. Just want you to know the main pathway for now. Okay, so again, here is the common iliac. Here's the external iliac. As we follow it down this way, you could see here's the femoral, not to be confused with the deep femoral. Okay. As we move down, back of the knee, popliteal, follow it down. The popliteal comes down, breaks through the tibia and fibula to become the anterior tibial. And that gives rise to the dorsal pedal, which is the pulse that you can feel on the dorsum of the foot between the first and second toe. Okay. On the posterior side is the posterior tibial and the fibular. Okay. Those are the biggies. Little bit of a blown up version of it, again, in case it was a little tougher to see. Common iliac comes down. Here's the external iliac. And if there's an external, there's going to be an internal, right? We can see the internal going right here, right there. And it looks like off that internal is where the obturator artery is. That's going to go to most of your adductor muscles. So here's the external iliac coming down, 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 which now becomes the femoral in the thigh. The one that makes that hook coming off it, that's the deep femoral. Okay. Then we come down, down, down. Now you can see it's a lighter red behind the knee is the popliteal artery. Now we're looking at the posterior side, right? Here's the sacrum. Here's the iliac crest. Here's the greater sciatic notch, the lesser sciatic notch, right? We're looking at the posterior part. So here's the femoral artery from the back. You follow it down, it takes you to the popliteal, right? Again, it's the same structure. It just changes its name based on the location of where it's at, okay? Then we're looking at the anterior view. Here's the anterior tibial artery, which again is coming from the popliteal. It just goes from back to front. It has to find its way between the tibia and the fibula, and it sneaks its way in right here between the fibula and the tibia, and there it is. Then it kind of branches down, and we can see the dorsal pedal. Dorsal, the top of the foot is called the dorsum. Don't think dorsum back, right? Even though it's the back, this is the top of the foot. It's like the dorsal fin. Okay. And what else do we have that I want you to know here? Dorsal pedal. We have a fibular artery that's off of the posterior tibial. Okay. From the back side, you can see the anterior tibial right here, and that's what's kind of going to the front to become the dorsal pedal. And then here's the posterior tibial, and it's going to have a branch to become the fibular artery. Okay, right here, fibular. Okay. Here's the entire view from the posterior. We've seen this already. Let's focus on the femoral, popliteal, anterior tibial, which goes to the front. Posterior tibial is more posterior, and the fibula has to be lateral. It has to be lateral. So if you look at it, it's kind of like this. It's going this way, like that. And again, that's off the posterior tibial, which is here. Okay. So you got posterior tibial, fibular, and popliteal. Popliteal goes between the tibia and fibula to go to the anterior part of the leg and to the dorsum of the foot. Okay, when we come back, we'll get into the venous system.